Thank you so much for the opportunity to speak about this important issue today. I'm speaking also on behalf of my colleague, Dr. Marcus Backhuber, who's ill today. My name is Dr. Julia Arnsten. I'm a professor of medicine and chief of the Division of General Internal Medicine in the Department of Medicine at Montefiore Medical Center and Albert Einstein College of Medicine in the Bronx, New York. Marcus Backhuber, who's not here, is an assistant professor, also with the Division of General Internal Medicine at Montefiore and Albert Einstein College of Medicine, and he assisted greatly with preparing this testimony. The opinions that we're expressing here are our own, and they do not necessarily reflect the views of Montefiore Medical Center or of Albert Einstein College of Medicine. Dr. Backhuber and I are both practicing primary care internal medicine physicians with a focus on chronic pain treatment, substance use disorders and their treatment, and addiction medicine. We're both registered practitioners with the New York State Medical Marijuana Program for over a year and are actively certifying patients who are in need. In addition, we're both active clinical researchers with several decades between us of NIH-funded research in the areas of substance use disorders and chronic illness. Specifically, our research has focused on interventions to reduce some of the harms that come from using opioids, by which I mean both opioid pain medications and illicit opioids such as heroin. While marijuana legalization and regulation in New York State have potentially wide-reaching effects in multiple health-related sectors, including the profound public health impact of incarceration, we focus our testimony today on the potential impact of marijuana legalization and regulation on the growing and increasingly lethal opioid epidemic. First, we will review the evidence regarding the impact that medical marijuana laws, which are now in 29 states, have had on the opioid epidemic. Next, we'll discuss early evidence that broader legalization and regulation of marijuana may have an impact on the opioid epidemic going forward. In 2014, Dr. Backhuber authored an important research study which was titled Medical Cannabis Laws and Opioid Analgesic Overdose Mortality in the United States from 1999 to 2010. The article was published in a prestigious medical journal, the Journal of the American Medical Association, Internal Medicine. The study examined the relationship between medical marijuana laws and fatal overdoses from opioid pain relievers, comparing states with medical marijuana laws to states that did not have medical marijuana during the time of the research. Dr. Backhuber was motivated to study this because of his own experiences hearing from patients who reported using medical marijuana as a substitute for opioid pain relievers for their chronic pain. He used death certificate data, which is compiled by the CDC, to look at the rate of prescription pain reliever overdose deaths over a 12-year study period from 1999 to 2010. During this time, overdose deaths increased in all states, but the average yearly rate of opioid pain reliever overdose deaths in states with medical marijuana was about 25% lower than the average yearly rate of opioid pain reliever deaths in states without medical marijuana. In other words, Dr. Backhuber found in this study that the availability of medical marijuana may have led to a relative decrease in fatal opioid pain reliever overdoses. Since this study was published 3 years ago, these findings have been confirmed in 2 additional papers, one by a Dr. David Powell and colleagues from the RAND Corporation, and another study which is forthcoming led by Dr. David Bradford and colleagues from the University of Georgia. Even though all of these studies look at state-level trends in an ecological framework and don't therefore allow us to make conclusions about any one individual's behavior, we believe that these findings support the conclusion that people are choosing marijuana over opioid pain medications in states with medical marijuana to treat chronic or severe pain, which is the most common condition reported among people using medical marijuana. Avoiding opioid medications in favor of medical marijuana lowers the risk of opioid overdose, either because individuals do not progress to opioid use disorder or they do not accidentally overdose on the opioids prescribed to them. In either case, the most likely explanation for the findings in this group of studies is that people chose to substitute medical marijuana for opioid pain relievers, therefore lowering their risk of opioid overdose. This hypothesis was tested in another related set of studies conducted by Dr. Bradford and his colleagues in Georgia. In one study, which focused on Medicare beneficiaries, published in a journal called Health Affairs, Dr. Bradford found that in states with medical marijuana laws, there were fewer prescriptions written for a variety of medications for which medical marijuana might serve as an alternative. These include many different classes of pain medications, many classes of sleep medications, and medications for anxiety. The largest decrease, however, was seen in prescriptions for pain medications, mostly opioid pain relievers. In a similar study of Medicaid beneficiaries by the same team, the findings were similar. Medical marijuana laws were associated with lower rates of prescription for pain medications and other medications, and also, importantly, with lower overall Medicaid spending. I can tell you also that my own personal experience echoes the findings of these studies. Since early last year, I have been evaluating patients for certification in the New York State Medical Marijuana Program through a weekly clinic at Montefiore Medical Center in the Bronx. I've evaluated many patients with chronic pain from multiple etiologies, including spinal crush injuries, peripheral neuropathy from HIV or other neurologic disease, cancer, multiple sclerosis, fibromyalgia, and many other causes. All of these patients have tried many different patient treatments for their pain, including surgery, injections, and in almost all cases, opioid pain medications. All of these patients would like nothing more than to live pain-free without using any opioid medications, and many, with the addition of medical marijuana, are achieving that goal. To sum up this part of the testimony, the available evidence in our own experience suggests that medical marijuana is associated with decreased use of prescription pain medications, and also, and more strikingly, with decreases in opioid overdose fatalities. Our belief is that this is due to individuals substituting marijuana for opioid pain relievers. To test this idea, we have recently initiated a large project with funding from the National Institutes of Health to study patients who have chronic pain and are initiating medical marijuana. To conclude this testimony, I'm going to briefly discuss the potential of broader marijuana legalization and regulation on the opioid epidemic. While medical marijuana laws have allowed patients in 29 states to access marijuana to treat medical conditions, broader legalization and regulation would likely increase the number of people using marijuana to treat a variety of symptoms. Currently, obtaining medical marijuana in New York State and other states requires that the individual has a state-qualified condition, and further, that the individual is willing to register their name in a state database. In addition, the individual needs to be evaluated by a practitioner who has registered with the New York State Medical Marijuana Program and who agrees to provide ongoing care. Because of these limitations, it is highly likely that medical marijuana laws will only provide expanded access to a subset of patients with chronic pain who might benefit. To further examine this issue, Dr. Backhuber and I surveyed 1,000 customers at several marijuana dispensaries in Colorado. We specifically excluded individuals who were medical marijuana patients. Of the 1,000 customers who did not identify as medical marijuana patients, we found that almost 2/3 were using marijuana to treat pain. Even more striking was that of those who reported taking opioid pain relievers in the past 6 months, nearly 40% said they had decreased their dose of opioid pain medications, and more than half said they stopped taking these opioid pain relievers altogether. These findings suggest that de facto use of marijuana to treat pain is common, even among people buying so-called recreational or adult use marijuana. A final important point regarding adult marijuana use is whether it is related to opioid overdose mortality. This question was examined in one recent study by Dr. Melvin Livingston and colleagues at the University of North Texas, published in the American Journal of Public Health. The study examined trends in opioid overdose mortality in Colorado from 2000 to 2015, which encompassed the year in which Colorado embraced legalization and regulation, which was 2014. The study found that after legalization, there was a reversal of the previously upward trend in opioid overdose deaths that Colorado was experiencing. In summary, while legalization and regulation policies are relatively new and studies are preliminary, Available evidence suggests that legalization and regulation will have two immediate and important public health impacts. First, it will expand access to marijuana for medical patients, and second, it will decrease use of opioid pain relievers. Based on data from Colorado, there is also evidence to suggest that legalization may reduce opioid overdoses. Legalization and regulation of marijuana in New York State will undoubtedly have many implications. We focused our remarks today on the potential for this policy to reduce harms from prescription and illicit opioids and to expand access for medical patients. While further research is needed from states that have recently enacted legislation policies, there is reason to believe that legalization and regulation of marijuana in New York State will have a favorable impact on the opioid epidemic and on broader health outcomes. Thank you for listening.
Well, I just want to, do you know if there has been medical journal or other analysis in adult use states of the comparative impact on impaired driving or traffic accidents and deaths?
There's one study from Colorado which looked at impaired driving among youth, which did suggest an uptick in the number of, I want to say arrests, but I'm not sure that they were arrests. It depends on how that aspect is actually done, but the number of instances that were identified of impaired driving among youth in Colorado. And there were some concerns about the methodology of that study, whether the appropriate aggravating factors were controlled for, particularly alcohol. So there's one study.
Okay. Crystal?
Let me just first start by thanking my colleague, Mr. Gottfried, and certainly my colleague, Mr. Linthal, who is the chair of codes, who is not here today because he actually is not feeling well. I'm grateful that I could be here from Buffalo. I'm interested in this entire discussion. As Dick Gottfried did say, I do carry the bill. And coming from Buffalo in the county of Erie, where we have experienced just out of control numbers of opioid deaths, it's refreshing to hear your testimony today. I would, however, ask if in any of the studies have you seen a increase in youth usage of marijuana?
I believe that the best data for looking at youth use of marijuana comes from a large survey called Monitoring the Future.
Say it again.
Monitoring the Future, which is a big survey of drug use among youth, primarily across the country. And there has been a kind of steady, a slight uptick in use of marijuana among youth over the last couple of decades. That's what that study shows. I don't think that we can relate that to any of these, to the passage of any of these laws. They're too new.
Okay, so do you know if there's any impact of marijuana being maintained as a Schedule I substance by the state or the federal law? Has that deterred? I mean,
well, speaking primarily as a clinical researcher, I would say that the major impact for us of marijuana being a Schedule I substance is that we are really unable to do research with it. So what we would like more than anything else is to be able to fully evaluate the impact of marijuana on a variety of medical conditions: pain, neurologic disease, anxiety, PTSD, sleep disturbances. And right now, in order to do research with marijuana, the marijuana needs to come from one particular facility, which is maintained by the National Institutes of Health, which is a grow facility in Mississippi. And they provide the marijuana, and one is able to dispense it to participants in a study. It doesn't allow us to examine any of the the specific issues that we're interested in, which have to do with things like the ratio of THC and CBD, the two main components, and how they might impact different disease conditions. And what we know about the endocannabinoid system and its importance in regulating a variety of vital human functions makes it very frustrating that we can't do that research. So from the perspective of a clinical researcher, the Schedule 1 maintenance makes it almost impossible to do research. To really, I mean, all of these questions that we're talking about, we're having a tremendous amount of trouble answering because we're unable to do the kind of rigorous research that we need to do.
Thank you.
Thank you very much. As a clinical researcher, I was just wondering, are you aware of any studies right now that may be ongoing or in the future that would actually use medical marijuana in the actual treatment of opioid substance abusers in a controlled environment? So I tend to, I'm more interested in the alcoholism and substance abuse area of this hearing, and I would be interested in knowing if we could help those that are currently addicted to opioids by possibly using medical marijuana as an alternative and maybe help them get off the opioids faster. Because as we know, the opioids are extremely addictive, and as is nicotine and cigarettes. And if we could find an alternative to helping that pain management and also maybe helping someone with the addiction that they currently have of the opioids, this may be an interesting topic for you to look into, and I'd love to see someone do some sort of research on that.
Yeah, it's a great question, and it's a really important question. Right now, the most efficacious treatment that we have for opioid use disorder are medications that compete with the opioid at the opioid pain receptor. So those are methadone and buprenorphine, and and even getting those medications to be widely available and to people who need them has been a struggle. We've done better in New York State than many other places, but those are the best medications right now, and sort of they target the exact receptor where opioids like heroin and pain medications work. The marijuana targets a different system, the endocannabinoid system, and there may be some crossover, as there is crossover, for example, between the benzodiazepine class of medications and the opioid class of medications, but there has not been, to my knowledge, any rigorous study looking at how marijuana may be used to reduce craving for opioids or to reduce the withdrawal symptoms that people who are dependent on opioids have, which are our two main targets when we're treating opioid use disorder. We're targeting craving and we're targeting withdrawal. And we haven't been able to look at that, and that's partly because it's very difficult to do research with marijuana of any form.
Well, I hope that after this hearing, something will come out of it and somebody would start to look at that, because the astronomical amount of money that we're spending on treatment that seems to not be doing the right job, because we have a relapse rate among opioid users staggering compared to other substance abuse issues because of the highly addictive nature of the opioid to begin off with. And unfortunately, I don't think the treatment is currently working. And I would love to see if there would be some sort of alternative, and if medical marijuana could be that alternative, we could maybe save a lot more lives.
You're absolutely correct. Even our best treatment only has a 25% success rate. The treatments of the opioid substitution therapy of methadone and buprenorphine only have a 25% success rate for opioid use disorder. So we're not doing that well.
Thank you very much for your testimony.